Good day, ma'am. I'm your student nurse, Precious Grace Ferrain Gabon from GH Cerelia State College, Pagadian, and I will be performing the head and neck assessment for today. Good day, ma'am. I'm your student nurse, Precious Grace Ferrain Gabon, and I will be assessing your head and your neck for today. Is that okay with you, ma'am?
Okay.
So, may I have your name and age, ma'am?
Mylene Pabalay, 47 years old.
So, in this process, ma'am, I might be touching your head and your neck. And I will be requesting you to lift and turn your head from right to left. Is that okay with you, ma'am?
Okay.
So, don't worry, ma'am, because everything that we done here will be confidential and private. Only you and me and the rest of the medical team who are attending your proper care will be the one to know your findings, okay? So, we can have your accurate assessment and treatment for today. So, okay, before I will start, ma'am, I will do hand washing first, okay? Okay. So, okay, Mrs. Pabalay, may I ask if you have experienced previous problems with lumps, bumps,
No,
itching,
no,
scaling,
no,
or dandruff, ma'am?
yes,
How about the loss of consciousness,
no,
dizziness,
no,
seizures,
no,
headache,
yes,
facial pain or injury, ma'am?
no.
So, how long does your headache last, ma'am?
For an hour.
Any cause of this pain, ma'am?
Stress.
What other symptoms occur with it?
Nausea.
How does it affect you, ma'am?
Can't work properly.
How do you treat it when you experience this kind of pain, ma'am?
I drink paracetamol, relax, and take a nap for an hour.
So, when did it happen?
And I'm busy with my work and as well as stress.
So let's start, ma'am. I will be checking the size, shape, and configuration of your head. Okay, so as we can see, the head shape of the patient is oval, which is normal and appropriate according to its body size. No lesions are visible. There's no abnormal movements or twitching of the face, and that can control and involuntarily we can see anything. The head is still upright. In palpating the head for consistency, we have to wear gloves. Check the head. This is important so that we can check if there are any masses indentation, especially in the hair. We can also check if there are skin conditions, an infection like lice, lesions, or lumps on the head that may indicate recent trauma or a sign of cancer. Okay, so the head is normally hard and smooth, and there's no lesions and parasites. Okay, so now I will be inspecting the patient face for the symmetry, feature, movement, expression, and skin condition. It is important to check if there are any abnormal movements like twitching of the face that is involuntarily, as what I have said a while ago, and we should also check if the face is symmetrical and there's no droopy in one side, example like Bell palsy or stroke. We just also look for the eye and the ears if they in the same level. So now, ma'am, I will check your eyes for edema and hollowness. So now, and we'll go ahead and look for the facial expression and test the cranial nerve 7, which is the facial nerve. Um, can you elevate your eyebrows, frown, or lower your eyebrows? Close your eye tightly for me, ma'am. Open up. Puff your cheeks. Now smile for me. Do you feel tenderness and pain, ma'am? So, okay, there's no abnormal movements noted. Facial nerve is properly working. So next, we're going to palpate the temporal artery for tenderness and elasticity. In this way, we can test the cranial nerve 5, which is the trigeminal nerve. This nerve is responsible for mass occasion. Place the index finger over the front of each ear to your patient. So in this area. So, can you bite down your teeth for me, ma'am? Okay, so I can feel the temporal muscle here, and the temporal artery is elastic and not tender. Um, so now, we're gonna go ahead and feel the temporomandibular joint, and we're gonna feel it right here. So, can you open your mouth, ma'am? So, normally there is no swelling, tenderness, or crepitation with movement. And now we're done with the face, and let's now proceed to the neck. So now I will observe the client's slightly extended neck position, symmetric, and lumps or masses. I will use my pen light to shine a light for the side of the neck across to highlight any swelling. So the neck is symmetric, with head centered and without bulging masses. So now, I will be inspecting the movement of your neck, ma'am. Can you swallow a sip of water, please? So the thyroid cartilage and cricoid cartilage move upward symmetrically as the client swallows. So now I will be inspecting the cervical vertebrae. So can you flex your neck from chin to chest, ma'am? So I will be inspecting your range of motion. Can you turn your head to the right and to left side, ma'am? Chin to shoulder, please. Okay. Touch each ear to the shoulder. Touch chin to chest. Lift the chin to the ceiling. So, this is to ensure that the client has normal neck movement and it is smooth and controlled. Now, I'm going to palpate the trachea by placing finger in the internal notch to feel side of the notch and palpate the tracheal rings to ensure that the trachea is midline. So, the trachea is midline. So now I'm gonna palpate the thyroid gland to locate the key landmarks with index finger and thumb. Okay, ma'am. Can you lower your chin to the chest, ma'am, and turn your neck slightly to right? Okay. Okay, ma'am. Swallow. So, okay, the loops are smooth, rubbery, and free of nodules. Okay, now I'm going to auscultate the thyroid only if I find an enlarged thyroid gland during inspection or palpation. Okay, so I will place the bell of my stethoscope over the lateral lobes of the thyroid gland. So, can you hold your breath so that I can obscure any tracheal breath sound while auscultating, ma'am? Okay, so no brutes are auscultated. Okay, I will going to palpate the lymph nodes. Can you tell me if you feel any tenderness or pain while I'm palpating your lymph nodes, ma'am? Okay. So the preauricular nodes.
None.
Okay, there's no swelling or enlargement and no tenderness. The postauricular nodes.
None.
Okay, there's no swelling or enlargement and no tenderness. The occipital nodes.
None.
Okay, there's no swelling or enlargement, no tenderness. Okay, the tonsillar nodes.
None.
Okay, no swelling, no tenderness, no hardness is present. The submandibular nodes.
None.
Okay, no enlargement or tenderness is present. The submental nodes.
None.
Okay, no enlargement or tenderness is present. The superficial cervical nodes.
None.
Okay, no enlargement or tenderness is present. The deep cervical nodes.
None.
Okay, no enlargement or tenderness is present. The posterior cervical nodes.
None.
Okay, no enlargement or tenderness is present. The supraclavicular nodes,
None.
okay, no enlargement or tenderness is present. Okay, so that's all for today, Mrs. Pabalay. Thank you for participating in this assessment.